It's a privilege and a pleasure to be here with you today. Really excited for the whole lineup that you have. I will hopefully set the bar pretty low, so I think everybody to follow will have some really interesting things to say. Really excited for the next couple of hours, but want to start out by sharing with you a little bit about what I think the future of health benefits can look like in America, and how that could relate and be helpful for SCRS. And to lead things off, I want to share a personal story about how health benefits and collision repair collided, if you will, for me. I'm a car guy. I love cars, I always have. And I was at the track about a year ago, and we had a full track day, a bunch of people there. It was a great day. And towards the end of the day, the instructor took the wheel and did a few hot laps. And then I got into the driver's seat after that, chest puffed up, thinking, yeah, I'm going to do what he just did. And going around towards the end of the lap, I'm coming down the pit lane straight on the track. And everybody's there, of course, so in full view of everybody. I go to brake into turn 12, which is a 90-degree turn to the left. And as I hit the brakes, the brake pedal goes pretty much to the floor. So as I'm flying off the track onto the grass and into the gravel, the car is spinning towards the wall in front of me. In hindsight, I can tell you I was very glad both to have had excellent health insurance coverage and to have good friends in the collision repair industry. The story has a happy ending. I walked away, and my car almost walked away, having stopped about 10 feet from the wall. So that was a minor problem in the grand scheme of things, but I want to talk about what is a much bigger problem, perhaps arguably one of the biggest problems that our nation faces, and that we as small business owners and managers and workers face. That is health benefits. Healthcare spend is the largest fraction of GDP in the country. Over 18% of our GDP goes to pay for healthcare. Over $1.2 trillion, the last time I looked, is spent on employer-sponsored health insurance alone. It's something we have to think about, like it or not, sometimes on a day-to-day basis to attract and retain talent, but it's laden with so many problems that there has to be a better solution out there. It may seem too good to be true to say a health plan that your employees could love, but what we at Gravie believe is that it's a mission that's worth striving for. Our mission is to build a health plan that everyone can love, and I want to share with you a little bit today about our story and my story, what I've learned on the road to get there. When I started at Gravie about 10 years ago, we looked very much like this picture. We had a long road ahead of us. We were not a health plan at that time, but we saw a need in the market. We had actually started in the individual market space, building the precursor to what is an ICHRA product today. And that's another story for another time. But when we looked at the individual market plans, at the group plans out there, we said, gosh, these plans haven't changed in 30 years, and we don't really see a plan that meets people's needs, either from a cost perspective or a value perspective. So we decided that we were going to take the plunge, start down this road, and design a health plan of our own. We were going to redesign health insurance with the aim of making it quite a bit better for the member and for small employers like yourselves. Let's talk a little bit about what the problem is that we set out to tackle, because I think this informs our vision of how to make this problem better. Health insurance is wickedly expensive, as we all know. It costs over $12,000 per employee per year to insure an average American. And that's rising at an unsustainable rate, going up 8, 10, 12% year over year. And when you compare that to how most businesses' profits are expanding year over year at GDP, 2, 3, 4%, that's an unsustainable cost curve when your health insurance spend is eating more and more into your profit year over year. It's just at a breaking point for many businesses. And what's more, most of that spend goes to benefit very few people. We found that 90% of employers spend on average benefits only 10% of their people, the most sick people who are really using the health insurance, with the result that most people feel like they're not actually getting a benefit from their health plan. Most people feel like they don't actually have coverage when they go to the doctor's office because they have these wicked high deductibles to spend, or copays and coinsurance, and it feels like the health insurance company is nickeling and diming you, and it doesn't even feel like you have coverage at the end of the day. So no surprise then that when you have a product that you're spending all this money on and very few people get value out of, health insurance has one of the lowest satisfaction scores in the country. Second or third, I think, only to telecom and cable TV. No surprises there, maybe. So what do you do in the face of that problem? Has there been any innovation? Not really from the carrier side of things. Like I said, for the last 30 years, not much has changed except prices going up and deductibles going up. There has been some innovation outside of the carrier space. On digital health, there's been billions and billions of dollars poured into interesting digital health solutions that are often sort of point solutions. Think about things like telemedicine, really exploded during COVID, or apps that help you to manage your chronic condition better from the comfort of your home, from your phone, to name a couple of examples. But one of the problems with this stream of innovation is that it's really only been accessible to large self-insured employers. These are point solutions that are selling to big jumbo employers and getting plugged in directly to them. They don't have an efficient channel to go to small businesses like us and like Gravie, which means that most of those businesses are left behind and don't have access to these services and this innovation, and that means that the consumers, the members, the employees who work for these businesses are also left behind. So what does that leave us with? It leaves us with a problem. Hasn't been a whole lot of innovation to address it, especially for small to mid-sized businesses. And guess what? SMBs, small to mid-sized businesses, make up over 50% of the American workforce. More than 50% of working Americans work for a business that has fewer than 500 employees. And it's at a breaking point. This is where we think that Gravie comes in, and where we have tried to approach this market and this problem through a fresh set of eyes. I've talked a little bit about how innovation has struggled to come to market so far. Here's a question: where then could innovation come from in the future? I think legacy carriers are probably ill-positioned to be the true innovators in this space to solve health benefits. They don't have the incentives, for one. They already have market share. They're already making billions, if not many, many billions of dollars off of the legacy products they have. They don't have the incentive to redesign that and cannibalize their own business. So I think we have to look outside of the legacy carriers. And one of the principles that we have found, that I've found to be true, is to come up with a better solution, you really have to have a perspective shift. For me, that perspective shift is focusing on the member at the end of the day. The member, or the consumer, the employee, is often a captive audience left behind with traditional health insurance. Large carriers sell to brokers. Brokers present one or two options to an employer. The employer makes a decision. They may not have great options to choose from, and the employee is sort of a captive audience at the end of the day. We think it's really important to flip that dynamic on its head, to start with the employee, the consumer, who's actually using the health insurance, who's the one who actually needs it, design a plan with their interests in mind, and then sort of take a step back and align their interests with everybody else in the value chain. So make it a win-win, not just for the employee, but for the employer also, who's paying for most of the coverage, by the way, and wants to use it as a way to attract and retain talent. Align their interests with the broker too, and ultimately with the insurance company. I'll give you an example of how that came to life for us. You want to start with the perspective of the member. It's probably a good idea to talk to some members, talk to some consumers and some customers. We were talking to one of our customers down in Texas when we knew we had to redesign health insurance, and they're actually a supplier to the automotive industry. And they told us, hey, we really want to remove the barrier to entry for routine care for our employees. When you or I might think a $30 copay isn't that much to pay for them, for some of their hourly workers, that was a big enough barrier that they weren't getting the care that they need. And that was a real big dissatisfier. We really pulled on that thread, and that in part led us to a redesigned health plan that we think aims to give value to everybody from day one. It's a shift from insurance to benefits, where insurance is about paying for catastrophic things that are really expensive, that don't happen that often. We've made the shift to conceiving of a health plan as a benefit that people can use day in and day out for all of their routine care, that helps to give them peace of mind, removes barrier to entry, and helps to keep them healthy in the long run. So Comfort, our flagship plan, we've designed it to be a benefit plan, not just an insurance plan, but a benefit plan that employees can actually use. I'm mindful of time, but I want to share a couple examples with you of how our plan and how this vision has come to life, not as a sales pitch, but as a way to illustrate how I think and we think at Gravie that innovation is possible in this industry. So our answer to this problem is a plan that provides 100% coverage on most common services. That includes 85% of people's encounters with the healthcare system at no cost. Routine primary care, specialist care, urgent care, labs, imaging in an office setting, generic drugs, all these are covered at no cost on the Comfort plan. And we've simplified the remainder of the plan as well, meaning that people only pay towards one number, an out-of-pocket max, if they have one of those more catastrophic events like a hospitalization. So principle, providing a lot more value from day one and simplifying things, super important. This just highlights how that compares to a traditional plan that has a bunch of copays and coinsurance and terminology that a lot of people don't even understand. But on the note of simplicity, we've really tried to remove all of the gotchas from the structure of traditional health insurance. There are no hidden costs, no surprise bills. We think that that simplicity and that transparency is super important as well. We've integrated, another principle is to be able to stand on the shoulders of giants, others who have innovated and bring that innovation into the health plan. So what we've done, where we talked a little bit earlier about some of those digital health solutions that only large employers have had, we've brought those to bear for our SCRS customers, for all of our customers with our Comfort plan, integrating them at no cost into the plan so that small businesses who have Comfort have access to those for their employees as well. You don't have to be a large employer anymore to have free digital physical therapy or free telemedicine. That's just a part of our expanded view of what a health plan can look like. And speaking of expansion, we believe that the future of health benefits is more than just a benefit plan or insurance plan that dictates what the health plan pays versus what the consumer pays. We believe that it has to walk with the consumer end to end on their journey through the healthcare system. That might start with looking for a provider. It probably ends with paying a bill sometimes. That's a very complicated journey that most people don't really know how to navigate on their own, and there's nobody that's helping them to do that. Gravie Pay is one of our steps towards helping people complete that journey. When you get a bill with Gravie Pay, you can pay that over time at no interest. So it's essentially a line of credit that costs nothing extra to the member, that is built into our health plan, that helps them to afford when they do have one of those catastrophic events. It's no longer an event that could generate bankruptcy or be a real strain on their family. We help them to spread that over time and have a more holistic solution for people. So I'm mindful of time and seeing Aaron in the back. Maybe I'll wrap just with a few notes to show you sort of the impact that we've been able to have with Comfort. We are proud to be able to save employers money when they switch to this plan. A health plan that everyone can love has to work financially. And bear in mind, this will not be a panacea. It's not a solution where it saves money for every employer profile and every year. But what we aim to do is to pass through savings when we can and to give employers upside in years when they run well, and in years when they don't run too well, be transparent about what's happening. We share data at an unprecedented level with our customers to try to give employers a little bit more control and transparency over what's going on. And we think that's important to building a long-term relationship and helping you as employers to plan out the financial future of your health benefits and take a little bit more control, while still providing a fundamental benefit to employees that they're going to be hard-pressed to find elsewhere that helps them to manage their health well over time. Maybe in closing, I'll share that of the over 300,000 no-cost services that we've been able to offer people to remove that barrier to care, to get the care that they need, over 3,000 of these come from SCRS employees, spouses, children. We think that we're just getting started, but we're very proud and appreciate this partnership and look forward to working together to bring more comfort and better access to healthcare to you and your employees and their families. So would love to speak with you more. After this, we and our partners at Decisely will be here to answer your questions. But with that, I want to say thank you very much for your attention.